Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: how long does fentanyl stay in your system? Fentanyl is a powerful synthetic opioid pain medication used to manage severe pain, typically in cancer patients or those undergoing surgery. Fentanyl is available in several different forms, including injections, lozenges, and the fentanyl patch being one of the most commonly prescribed. While fentanyl can be highly effective in managing pain, it also carries a high risk of addiction and overdose. So it's important to understand how long it stays in your system. Fentanyl is a dangerous drug that can show up on urine and hair tests for up to 4 days or 2 days in the case of blood tests. But it can still be detected longer depending on several factors. Fentanyl's effects can last well beyond its testing window, even if someone successfully passes their fentanyl drug test. They could still be at risk of an overdose due to its long-lasting nature. If fentanyl addiction takes over, medical interventions such as medications and therapy are needed to help people break free from fentanyl abuse, while doctors prescribe it to treat severe pain. Illegal fentanyl is abused for its intense high. When this potent synthetic opioid binds to opioid brain receptors, it produces a sense of exhilaration. However, these receptors become tolerant over time, which leads to dependence and addiction. Fentanyl is so potent that it can take seconds to several hours to start working. Tablets, lozenges, and nasal sprays reach peak potency in 15 to 30 minutes, while patches may require up to 2 days before their effects become fully felt. Intravenous use results in an almost instantaneous high but with briefer outcomes than other routes of administration, lasting about 2 to 4 minutes at full intensity. Fentanyl has a half-life of approximately 3 to 12 hours, meaning it takes about that duration for the body to eliminate half of the drug. Discovering how long a drug lasts in your body is crucial, known as its half-life. Fentanyl, for example, is broken down mainly by the liver via an enzyme called CYP3A4. Following consumption, the drug exits your body through urine. Furthermore, fentanyl's half-life differs based on the dose form used. In general, removing a drug from your system takes 5 half-lives. With this in mind, understanding half-lives can help foresee how long fentanyl may still exist in your body. You may be wondering, does fentanyl show up on a drug test? Fentanyl can and does show up on a drug test. Fentanyl is typically detectable through blood, urine, hair, and saliva drug tests. Here is an estimate of fentanyl drug test detection times. Blood fentanyl drug test, up to 48 hours. Urine fentanyl drug test, up to 72 hours. Saliva fentanyl drug test, up to 72 hours. Hair fentanyl drug test, up to 90 days. Fentanyl drug test detection times are estimates that vary from person to person. Additionally, the duration of fentanyl's effects on a person's body can differ from the length of time it can be detected in the body. Fentanyl drug tests can produce false negative results on some standard panels, which may not be sensitive enough to detect it. Therefore, it is recommended to order special laboratory tests that can specifically detect the presence of fentanyl in the body. Moreover, disclosing any prescription or over-the-counter medication used to your healthcare provider or employer before undergoing a drug test is essential to prevent any misinterpretations of the results. As with any controlled substance, it is crucial to seek medical guidance and observe the instructions of a skilled medical specialist. How long do fentanyl stay in your system? If you or a loved one are using fentanyl, it's important to understand the drug's risks and seek professional help if you're struggling with addiction. We'll explore the factors that affect how long fentanyl stays in your system, and the potential risks and benefits of using this powerful medication. The time that fentanyl remains in a person's system relies on age, weight, metabolism, kidney function, liver function, and the amount and frequency of use. The detection time for fentanyl varies from person to person. Numerous factors can impact how long does fentanyl stay in your system, including dose. A larger dose of fentanyl may be detectable longer than a smaller one. Frequency. Regular fentanyl use can extend the detection time, unlike occasional consumption. Formulation. People taking fentanyl with a long half-life, such as transdermal formulations, could have detectable drug levels in their systems longer than those with a shorter half-life. Age. People over 50 may eliminate fentanyl from their bodies slower than younger people. Kidney function. People with kidney issues may clear fentanyl from their systems more slowly than healthy kidneys. Drug interactions. Drugs that affect CYP3A4, the primary enzyme responsible for breaking down fentanyl, can either lengthen or shorten the drug's effect. Illegal fentanyl is typically sold in powder form, placed into eyedroppers, and nasal sprays, added onto blotter paper, manufactured in counterfeit pills that mimic other prescription opioids. Fentanyl's active ingredients bind with opioid receptors in the brain responsible for the following: emotions and pain relief management, making users feel a heightened sense of pleasure. Continued use leads to tolerance, requiring higher doses to get the same effects until addiction eventually ensues, resulting in dependence. One of the biggest dangers of fentanyl is the risk of overdose. Even a small amount of fentanyl can be lethal, especially when combined with other drugs or alcohol. Fentanyl can slow your breathing and cause respiratory failure, leading to death. Fentanyl is highly addictive. Prolonged use can lead to physical and psychological dependence. Withdrawal symptoms can be intense, including vomiting, nausea, diarrhea, anxiety, and depression. Treatment can help manage withdrawal symptoms and provide support for long-term recovery. How to flush fentanyl out of your system. It can take some time for fentanyl to leave the body completely. Here are some general steps on how to get fentanyl out of your system fast. Stay hydrated. Eat a healthy diet. Get regular exercise. However, there are no proven methods to eliminate fentanyl from your system quickly. The best way to get fentanyl out of your system is to stop using it and wait for it to metabolize and leave your body naturally. If you are struggling with fentanyl addiction and want to get it out of your system, or if fentanyl is in your system, seeking professional help is paramount. Please call We Level Up immediately to learn how our detox and addiction treatment program will help you overcome your fentanyl addiction. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.